Meeting ID. Hello guys, online ulit ako because I want to share with you the meeting with KAFA tonight. Any minute mag-start na yun. Saan na yun? Saan ang link? Meeting ID 880. Ayun. Set up ko. Para ma-share ko sa inyo sa cellphone ko. Any minute mag-start na ang meeting natin. Thank you, Cynthia, for coming. Gusto ko lang kasing i-cancel. I-share ang mangyayaring meeting ngayon sa Zoom. Connecting. Set up ko. Test mic. Are we starting? Hi everyone. Hi Gina.
Are you hearing us in the meeting?
No,
Can you hear
I don't
us?
hear you.
Yeah, you're joining from the phone?
Yes,
from your
the
phone?
Yes, from my phone.
When you enter Zoom, you need to put connect audio call over internet. There's an option.
Yes, but
where
I
they
didn't
type.
see that option, but I will check it again, okay? Because I cannot
Okay,
hear.
please.
Okay.
Yeah, that's how you can hear us. Okay.
So
Yeah.
I leave first. I have to leave
Yes,
again.
Try leaving and entering again.
Okay.
And when this shows up, you put call over internet.
Okay.
Okay.
Type. I have to leave. Start video. Join audio. Call over internet. Allow.
Honestly, I was waiting for MSF to be with us, but it seems that on Saturday they preferred
I
not
can
to
hear you now.
join us.
Yeah, but it's fine. I mean, the questions also are very straightforward. So I think the most important is to have the voice of the workers. Any of us can share what we listen to here, but it's about the workers' participation.
Exactly.
Hello. Hello, Miriam.
Yes,
Thank you for joining.
Hello.
Mayra,
Sorry, I have my brain again.
Oh, سلامتك. Mayra, your microphone is showing, but you need to put unmute so we can hear you if you're talking. So I can see the microphone. This means you can hear us now.
Yes, I can
Just
hear
remove
well.
the mute when you want to talk.
I can hear you well.
Myra and Miriam, if you feel like you're using your data from your phone
No,
to
it's okay. It's okay.
to open the Zoom, you can just turn off your camera. It's totally up to you.
It's okay.
Miriam,
No.
you're
Miriam.
unmute.
But sorry, I'm in bed because I feel so cold.
Miriam, unmute yourself if you want to talk. Miriam, your mic is muted.
You know, if you have Miriam's phone, if you can send her a WhatsApp or
Yeah, I'm texting her.
How will I?
Hi.
Hi.
Yeah, now it's working.
Yeah.
Gina, I just want to ask, this is Zena of ILO?
Yes, so I will introduce everyone once they're here. Yes, this is
Hi,
Zena.
Hi.
hi, I miss you all. Hi, how are you?
You too. Good, yeah. I'm not working because
Hi, Gina.
and
Yes.
my brain, yeah.
I'm sorry. Good to see you.
Yeah, thank you so much, Zena.
Hope you'll get well soon. I
Thanks.
will move my camera.
Okay.
Jallo. Julia. Do we need to wait for the other?
Yes, Miriam, we're waiting for others to join. I'm checking with them. Meanwhile.
Okay.
Welcome, Julia. Thanks for joining us.
Hi. Hi.
Hi, hello. Hi, hello, Mariam. Hi, how are you? Napano ka? Jalo, hello, Jalo. Jalo is fluctuating. Jalo is fluctuating.
Hi, everyone.
Hello. Hello.
So, Cindy, is this you with the Huawei Wi-Fi?
This is Teresa.
Teresa. Hi, Teresa. Welcome.
Hi.
Thank you for joining.
Hi, thank you, thank you.
Miriam or Teresa or someone, are you in touch with Mala? I'm calling her. She's not picking up. She said she would join.
Yeah, Mala is still in Sri Lanka, and I think her connection is too bad.
Okay.
But she said that she will join, but I think if she has her connection, she will join directly.
Okay. Okay. So Cindy should from the Cameroon community should join us now, and let me check with one more group.
I want to share with you guys yung Zoom meeting namin with KAFA. KAFA is an NGO organization in Lebanon that protects women's rights. And it's not only that nakaano sila, basta ang focus is on the women's rights protection. But in other aspects, tumutulong din sila. Naka-glare ano.
Welcome, Cindy.
Hello, everyone. Hello, Gina. Thank you so much.
Thank you for joining.
Do you want us to start, Lena, or you should wait?
I'm just checking with one more person.
Okay.
we can start because one of the persons do not have apparently some access to internet at the moment, and the other is not picking up, and someone apologized because they won't be able to join. So I think we can start, and whenever the people who have an internet issue are able to join, I think they will join us right away. So yes, I think we can start now. I just want to start by thanking you ladies for suggesting the time today and joining us. So thank you for your time. So you know me, I'm Rena, I'm a social worker with KAFA, and we are joined today by Diana Maddah and Purity from EMT UK. It's an emergency medical team that was deployed by the UK government. I will leave it for them to speak about their work here. And we are also joined today by Mrs. Zena Mizhir from the ILO. We will stay together for 1 hour. We will try not to take too much of your time. And like I explained, today will be a focus group discussion to understand from you what do you know and what are your needs around COVID. So I will leave the floor for Diana and Zena to say what they would like to say. So
thank you so much. Thank you, Rena, so much, and thank you everyone for participating today. We know that you have work and you're busy, so we're trying as much as we can to make it very brief and short. We're not an NGO and we're not an organization. We came for emergency in Lebanon after Beirut blast on August 4th to help the medical team in the hospitals to build the capacity of those people by helping them to give the services for the Lebanese, like for anyone who's living in Lebanon. And also we're trying to reach out to people to spread awareness about COVID. I have my colleague Purity. She's a nurse. If you can, Purity, introduce yourself, please.
Thank you, Diana. My name is Purity, and as you have heard, I'm here working with UK Med EMT. And as Diana has said, we are here to have capacity building and support to the staff mainly in the hospitals in Beirut and in Tripoli. And our work is on RCCE and also on IPC and case management. So for me, I'm doing IPC, infection control and infection prevention and control, and also case management. So I was invited here by Diana, maybe to address some issues which people may have regarding the vaccination. Thank you.
Thank you so much, Purity. Purity also is from Kenya, so she might understand the issues with some ladies with us. So just for you to know that people are working in these organizations are not only coming from the best countries in the world. We have people who are very knowledgeable from everywhere, and we all are working like you, us, and everyone. We're doing our job, and I mean, everyone should respect us and feel to appreciate and to feel grateful about the work that we are doing. So thank you again, everyone, for being with us. And Zena, you need maybe to introduce yourself too, please.
Hi everyone, I'm Zainab from the ILO, and I know many of you because through you and your voice, we continue to work on promoting the protection of domestic workers and on recognizing domestic work as work. This meeting today is simply to hear your voice and your contribution, to see how all of us, organizations who are working to promote the rights of migrant domestic workers, can focus on the promotion of your right to have the vaccine, but also taking into account your own ideas, your fears, your expectations, what you know about the issues related to COVID and the vaccine in Lebanon. So I will not talk at all during this session. It will be more for to hear from you. And thank you so much for taking the time to join. Over.
Thank you, Zena. Let's start by you introducing yourself so to better understand your background, where are you now, and everything about you. Myra, would you like to start?
Diana, just if I could interrupt for 1 second.
Sure.
Does anyone mind us recording the meeting just to get back to it in case we needed to get back to it? Is that fine? It will be just for us to get back to the information. Do you ladies have a problem with that?
On my part, there's no problem
No
about
problem.
it.
No problem.
Great.
Okay, thank you. Yes, Mayra, please go ahead and tell us more about you and your activity.
Well, to start with is I am Mayra Aragon, one of the Filipino community leaders here in Lebanon. We have been doing the past almost a year now since the start of the lockdown, March. We started doing our relief operation just to help our countrymen, especially though some of other nationalities also come to us, and we do twice weekly distribution of relief food packs consisting of some 2 kilos of rice, cans of meatloaf, corned beef, beans, whatever, noodles, eggs, whatever we can put in the bags, just to help the migrant workers go on with their lives. As you know, we are also suffering not only because of COVID, we are suffering due to the economic crisis that we are experiencing. So most of the workers has lost 80% of their salaries, and with the rising cost of commodities, it's so hard to maintain, like just eat 3 times a day. So as community leaders, we try as much as possible to help them. In fact, we don't know what to do with this hard lockdown since we started January and until now, and it's very difficult for us to go out and for them to go out too. But still, we will risk this lockdown and just try to help our fellow countrymen and the rest of the community.
Thank you, Myra. Thank you so much.
Welcome.
Cindy or Miriam, who would like to go next?
Yeah.
Hello.
Hello. Hi, Cindy. You want to go first?
Go ahead.
Okay. Me? Okay. Yeah, so hi, I'm Miriam Prado from the Alliance of Migrant Domestic Workers. And also, what we are doing since the lockdown also and the corona started, COVID-19 started last year, I already engaged of distributing relief goods. I collaborate with the Rosa Luxembourg First, Rosa Foundation, and also we had the distribution of relief goods like going out to the mountains, Bika, north, south. We did all of this last year. And till now, and also from the Alliance, we are still doing our best to help the Migrant Community Center and the other nationalities also. And
What's your nationality, Miriam?
I am from the Philippines.
Oh.
Yeah. So even today, even it's locked down, and also last week, I tried my best also to go out, even with brace in my in my neck. I go out because I still have things to distribute. Today, I distribute 15 bags to the Kenyan community in Daura, in Badaro, and last week for the Nepalese community. So this funds that I have from the one I'm distributing right now is from the IDWF, and the one that we have for the Alliance, because it's locked down, we cannot go to our place every Saturday. That we are doing our repacking thing for the food bag. So I hope that the lockdown will finish soon so that we can continue our work. And some of my colleagues are here also, Teresa and Julia, they are here. And yes, they can also provide some information about the work that we are doing. Thank you so much.
Thank you, Miriam. Thank you so much for the great work you're doing. Cindy?
Yeah, hello everyone. My name is Cindy. I am president of Cameroonian community. The work we are doing is you help the Cameroonian girl for the repatriation, and also you try to distribute the food with, and we collaborate with many organizations who help us with the food and also medicine, and some of them help some of urgent cases with the rent, because now, because of the situation, many girls don't have a work, and so they are helping them with the rent, also with the food, and our main job is to talk to the girl in our country who want to come in Lebanon to know more about kafala system, and to know about our work, and also when they will be here in Lebanon, in case they have a problem with the employer, who to contact, where to go, and how to face the problem. That is our job. And now you are trying to work to register our group. That our group name is Together Forever. So we don't know, it's because of the situation now. You don't have the crane. You don't have the training now. So we are waiting. Maybe soon you will have the training to register our group. That is our job. Thank you.
Thank you so much, Cindy. This is really interesting. Thank you so much. Julia?
Hello, everyone. Good evening. I'm Julia. I'm from Madagascar, and I'm from Alliance too. As Mariam said already, we are giving food already every week, as because of the lockdown now, we cannot do it. But me also, I'm working with my church. They give for especially for Madagascar and African countries. So we share also really food every week. And now even 2 weeks now, I'm starting again to share with the church. I'm trying my best, but even I'm not going out, I'm standing. Some people work with me, some drivers, and some people also.
Julia, what's your nationality? I didn't hear.
Julia, Diana didn't hear you. She's asking about your nationality. Julia is from Madagascar, right? You're from Madagascar.
From Madagascar.
Thank you so much. And who's Hawaii Wi-Fi?
This is Teresa. If you could introduce yourself, Teresa, as well.
Okay. My name is Teresa Pontillas. I'm from the Philippines. I'm also one of the co-founder of the Alliance, and say what our
Teresa, your voice
is
is cutting.
doing and help for the rent of other. Hello, is it good now?
No, it's a little better when you started talking. Like, please go ahead.
Okay. As my colleagues already mentioned about our work in food distribution, and I want to add something that we are also providing, helping partial rent financially, and providing the needs of medicine, and also for the help for baby to those who have babies, giving them, providing them milk and diapers, and we are using the fund that we have. Thank you.
Thank you so much, everyone. I guess it's clear that you are being very active in the community, and you're trying to help each other. So this is really amazing. I really want to thank you for all the effort that you're doing. And now maybe throughout our questions, we might be able to see how maybe we can guide you more and protect you more, maybe. Let's see throughout our questions. So mainly, as you know, we're here today because we need also from you and also for you to be safe, to be protected from the pandemic, and for you to be able also to help us to better understand the knowledge, the skills, everything related to your work in relation to COVID itself. So our main goal is to understand your priorities. So we'll be able to see how together we can reach out to your colleagues, to other domestic workers, and to be able to spread awareness among them. So my first question is, do you prioritize, when I'm saying I mean that you or other domestic workers. So as you're representing now their voices, and you're trying now to give us ideas about the opinion, the situation, the status of those of the domestic worker in general. So in your opinion, are you prioritizing topics related to COVID-19 among other topics? So do you think like COVID-19 by itself is a priority for domestic workers to better understand it and to set it as a priority for them to understand, to get the information needed?
Yes, of course. Because we don't want to be dying here in a foreign country.
Sure, I agree. Okay. So, any other answer? Anyone would like to intervene? Please, the floor is yours, so please speak as much as you want.
If someone has a different opinion, or if someone noticed like or heard about something else and you would like to share, please feel free, like Diana said, just unmute yourself or raise your hand if more than one person wants to talk. And please feel free to say anything you want. We are here to know from you. Okay, so don't hold
Exactly.
back.
Because we're
Hi.
not. Yeah, Miriam. Go ahead. Hi.
Yeah, so for me, yes, it's about COVID, but I think most of the people they have already ideas and knowledge about what is COVID-19. But now, because of the vaccine, is there are some hesitance and there are some negative videos about the vaccine. I think it's more important also to raise awareness about the
The
vaccine.
vaccine. Excellent. Excellent. I have a lot of questions to you, ladies. So that's why I need you to help me to get all the answers so we can set a plan with KAFA accordingly. Okay? So let's can go directly to the first question, which is what do you know? What's COVID in your opinion?
Yeah,
What's COVID 19?
yeah, it's a kind of flu that it's a very strong flu that even if you have a weak immune system, then I think you can catch it. But this is what I understand.
Okay. Yeah,
For
which is
me,
good. Okay.
COVID is a sickness caused by a specific coronavirus that affects the lungs of a person. But coronavirus has been in existence long time ago, but they mutate from time to time, and this one is a stronger one, and it affects the lungs of a person. And what is very frightening is because when you have this COVID-19, the phlegm, it's like a cement that goes down to your lungs and get hardened on the lower part of the lungs. That's why it causes difficulty of breathing.
Oh, Myra, excellent. Excellent job. Yeah,
Thank
actually, this
you.
is a very clear explanation about it. True. It's not a new virus, but it was like it's a new strain, if you want to say that. Um, and do you know the preventive measures? What are the preventive measures that we should take into consideration?
By wearing mask, social distancing, and always wash your hands. And if you're outside, you have to bring alcohol or any sanitizers if you're out of the house, and avoid people who are coughing and sneezing. But because sometimes we don't know if people are sick, so because we don't know who has corona, so it's better to have a social distancing.
Mhm. Excellent. Excellent. Now, what's the mode of transmission? How does it transmit from one person to another?
The mode of
How people
transmission
get
is getting
infected?
in direct contact with the COVID positive patients. Like uh, you were in contact with a positive patient, a positive individual, and you don't have the protective gears. You were not using the mask and touching infected surfaces, not disinfecting your hands, washing your hands. This is how we were gonna get it.
Mhm. Okay.
For me, it's through coughing. The people that who cough that is not covering their mouth and sneezing.
Okay. Okay. So, ladies, are you taking the preventive measures? Are you taking them?
Yes.
Yes.
As I said, we don't
Okay.
want to die.
And you
Of
don't want.
course.
Sorry.
As I said, we are taking the necessary precautions because we don't want to die.
Yeah. Exactly. Okay. And are you sure if like do you have any idea whether other colleagues, other domestic workers are taking also the preventive measures while they are working or they are in their shelters? Do you think, in other words, do you think what is the percentage of the domestic workers that are taking the preventive measures? If we want to give an estimation, a percentage.
In my assessment, it's about 95% of the domestic workers taking good care of themselves.
Mm-hmm. So yeah, Miriam.
Yes, for me, it's more than 95 because most of the domestic workers now, they are very aware and they are very afraid of corona. So they are very curious and very all the time they are talking about corona. But the problem is, even if they are, especially for the live-in domestic workers, even though they are taking care of themselves and they have this prevention, they're still wearing masks and all the time washing their hands. But the problem is the family inside the house, Madam and Mister, who are still inviting people for dinner and for lunch. So I know of some friends that they are positive because of this. So I think some, and I know people who are still inviting guests inside their house.
Jana, can I ask a question?
Sure.
So, for live-out workers, do you know or have you faced yourself a situation where the employers were not respectful of certain measures and you felt that you might be put in danger in terms of corona? Do you know of any such cases? And if yes, how would you face it?
For me, example, because I'm live out and I'm working from 7 to 7. Yes, I mean inside the house they're still inviting people for for coffee, for dinner. So, but usually in my case, whenever they have guests, I always make myself to be far away from them because if they are afraid, I want to take care of myself, because I'm alone here and I don't want to be sick also because I'm getting old and it's not because of corona but because of work. That's why I have all this illness. So I don't want to be any. Thanks God that it's been already 1 year that I'm still safe. So for me, only I have some friends that still live-ins that they have problems about employers that still inviting guests to have dinner with them. And I know some that they are still, I mean, they got infected and they got positive, but now they are okay, Yani.
Interesting. Yeah.
Anna, if I could ask something as well before moving to the second question. Is there, ladies, something that you would like to share, because you are conducting many field visits to the houses where live-out domestic workers are staying. Is there something specific that you noticed worth sharing about the precaution measures and the prevention measures that are taken in these places? Because sometimes many domestic workers live in one place. So if there's something that you noticed and you think is relevant, please do share with us. And please, everyone, feel free to step in whenever you like. If my question was not clear, I meant to ask if you noticed that for the live-out domestic workers who live outside together, if you think they are also following prevention measures like the rest of your colleagues who you know.
Yes, for us who are working outside, we make it sure that we are following the protocols, the health protocols, by wearing our mask and keeping the social distancing, and bringing always with us sanitizers. So every time we touch something, we make it sure that we uh, at least disinfect our hands, and not by always touching our mask and our eyes, or our, and with the, as much as possible, we try to keep our hair tied up. So also it's one of the protection, uh, and we avoid crowds.
Is there any challenge like financial, maybe sometimes financial, sometimes maybe physical? Because sometimes for people who are not living with, like who are living out, they don't have, they're not living in the houses of their employers. It might be a crowded area, for example. I'm just asking questions, so I don't know the situation there. And also, I would like to know if you're facing some financial issues with buying the sanitizer, the soap, the tools for the precaution.
With regards to the financial situation of the migrant workers, especially those who are working outside their employers, uh really, we are really in need of financial assistance, to say, but we make the most of what we have, because we cannot say that we don't have the money to buy, that we cannot afford it, and we will not just buy it. Health is wealth, so no matter how much it costs us, it's our priority to protect ourselves.
And now maybe Purity, after once we finish the questions, maybe Purity can jump in and say what are the cheapest method that we can use in order to protect ourselves. It doesn't mean to have alcohol from the pharmacy or and so on. So maybe Purity can interfere and talk a little bit about the cheapest way, quote unquote, for the IPC. Okay, my next question is, it seems that you have a lot of information. I need to know from where you got all this information. What is your source of information regarding COVID?
By social media.
Mm-hmm.
It's everywhere.
Facebook?
News,
Is it
Facebook,
Facebook or
WhatsApp,
what?
and everywhere. If you have telephone, you can gather from all this news in social media, because there is IG, there is Twitter, and everything. So you can have all this from the social media and from the akhbar and everywhere here in Beirut. But not all of them are accurate.
Do you know? Do you know how to differentiate between accurate and inaccurate information? Do you know what's accurate and what's not accurate?
Yeah, I just want only to have like example, because for me it's like that I don't believe exactly about the news here. Like last month they said that there were like 5,000 people died because of corona, and then the other day there is like 6,000 died because of corona. So I feel like, what is this? Is this right or what? So I don't know.
You critically analyze things.
Yes. And curious also.
Other ladies, Myra.
For me, as what Mariam said, that we get it from the social media, and specifically, I try to read on the reports of the World Health Organization, because I feel that this is the most trusted, the most trusted news that I will have. And then I also have a nursing background, because I took up Bachelor of Science in Nursing. And also, I'm connected with MSF. So we try to get informations from reliable sources.
Excellent. Now, I have a question here. So maybe you have this privilege and you are well knowledgeable and educated to get the information needed regarding COVID. But is it accessible to everyone? Like the social media and all this information, how we can make sure to reach out to everyone?
You know that.
So let's talk.
Okay.
Yeah.
You know, just reading in the news in the social media wouldn't supply all the information, the proper information to the readers, because there is a saying that says, uh, reading with comprehension. Sometimes people just read without the proper understanding of what they are reading. So they might lose the right understanding to what they are reading. So as for me, as a Filipino community leader, I try as much as possible to pass the right information to the community. So we go on also to the social media and try to give the news to them, explain to them the proper way of understanding this disease. So we go on Facebook, we go on YouTube, we go in Twitter or the Instagram.
And Myra, do you have do you have a WhatsApp group or Facebook group
Yes,
for you to be able to spread this information?
yes, we have the WhatsApp group, we have the Messenger group, I have the community in YouTube also, and the Facebook.
How many people reach, Myra?
Again, I didn't get the
How
question.
many people you have in your let's in other way? Do you have like an estimate number of the people that you are reaching through your messages?
Over 3K. Over 3K. And every time we distribute foods, we try to explain. Even really modesty aside, sometimes we sleep already around 2 a.m. or 3 a.m. because people are still messaging us, asking us some questions, and you cannot just disregard them and not answer their question. You have to reassure them, as we say, that in this kind of situation, mental and emotional health is very important. So you have to talk to them to make them feel that they are assisted, that they will understand their situation, and make them feel relaxed that we will recover it together.
Yeah, but Myra, my question was to how many people are you able to talk or to communicate?
On my estimation, I have around 3K followers.
Wow. And all of them are living in Lebanon, or like it's not only related to people who are located in Lebanon?
Most of them are in Lebanon.
Excellent. Okay. Okay. Let's move to talk about the vaccine, because now it's the trend today and we need to discuss it definitely. Do you have any fear regarding the vaccine?
Any fear about the vaccine?
Hi.
Hi, Miriam.
Yeah. For me, I'm honestly I do the vaccine, and for me, I want to pass, and I will let some people to do it first. I will wait for 1 year if they're still.
Okay. What's your concern, Miriam? Why? You're afraid from the side effects?
Yes, from the side effects and Yes, from the side effects and from the negatives of videos that negative news, negative vibes that I read about all of this and watch videos. And I have some friends from the US, and they are my classmates way back from the college, and now they are serving as frontliners because they are nurses. And there are some positive and there are some negatives also. And yeah. So for me, I feel like still I'm hesitant to do the vaccine, to have the vaccine.
Okay. Cindy, you were talking?
What I can say, for me, I think, I share about the vaccine. I need to have more information about that before I take it. So I need to have more information because I don't know anything about the vaccination for now. So if you can give them more, you can give us more information about it. Maybe I will take it.
Okay, but do you think is it accessible for you? Yani, did you try just like as a trial? Did you try to register on the platform that the ministry put and announced?
No.
And also in the announcement, it was like the migrants workers are not the priority for now. And thank God we are not the priority, because on my part too, like Miriam, I don't want to have the vaccine for now, because for me, I've been working with people, like every day I'm facing people, trying to help them. Since the lockdown of the COVID-19, I didn't get any infection. But why will I put the virus, the live virus now in my body?
For me, I tried to open that link. The link they say you need to register there, but I see the put they said you need to put if you are Lebanese or Syrian and Palestinian and the other people. So the other people, I think, is us, the domestic workers. So I don't know. I fear maybe they will not give us the good vaccination, or they will. I don't know. So I need to have very good information about that before I take it. So that is it.
Can you just elaborate? Like, are you afraid of something else if you like register your name on this link? Is there?
No, I am not. I am not afraid because of my name. I am afraid because they put like Lebanese first and Syrian and Palestinian after they put the order. The order is like us, like Africans, like Bangladesh, like us. The order is like domestic workers. So I don't know if they will be able to give us the good vaccination or no. I don't know. So we need first to close the people who will give us that vaccination and to have good information about that.
Okay, I see, Cindy. Thank you for sharing. Diana, are you back with us?
Yeah, may I ask a question here, before that?
Yes, sure.
Just to tap on this idea, just to follow up on what Rina just said, we know that many workers don't have their passports because it's with their employers, and many of them may have some proof of documentation, but they are irregular. Do you think that some of those workers may be afraid to register because they don't want general security to know about them? They don't want to be deported. The reason we're asking this is we want to see promote the principle that those who want the vaccine should have access to, but also we want to understand your own fears So we also promote how to protect you. So we don't want to put you in danger, but we need to understand there is the danger of the vaccine, the danger of COVID, but there's also other risks. So this is why we're asking these questions to try to see how, through your experience, through your dreams and fears, we can continue to work to support you in relation to COVID.
Yeah, I think that is a very good proposition. Uh, the first thing is we are afraid of the vaccine, of the reaction in our body, because every person has different threshold to with regards to the vaccine. And the second one is those undocumented also have their fears. Maybe if they will register and they will be asked for some identifications, and they cannot provide it, and then the general security will already know that these are the undocumented people, and come take them and bring them to prison. So really, this is a very nice proposition. It's very true.
Okay, so I'll tell you something which is very important. It's that regarding the vaccine, just to make things clear, regarding the vaccine, definitely we are able to conduct a session as you are leading the community, your community, and you have you will be able to reach out to thousands of people. Definitely, we can arrange like a second meeting with you if you are interested in that, to give you a session, awareness session about the vaccine. Definitely not to tell you you should get the vaccine. No, not at all. It's our main goal out of it is just for you to better understand the vaccine, how does it work, and what are the different type of vaccine that everyone now is talking about. So definitely we can do that in a second session, and maybe Rina will be able to help us to arrange a second meeting with you. And also you can feel free to invite everyone. Maybe we can do it live on Facebook if you have a Facebook page, and definitely we can help. But regarding the issue of the identity, I had a discussion with the president of the COVID-19 vaccine campaign in Lebanon, and I asked the same question, and he told us that it's not in any way the information given on this platform will be shared with someone else. It's only for them to call the number and to see if the one who register will come to the they are just asking for any paper that shows that you are this person. It might be a paper from your origin country. It might be any paper. So it doesn't mean that it's a way to catch people or to arrest people at all, because we mentioned that, especially because it's not only for the domestic workers. It's also for a lot of Lebanese people who are stateless, a lot of Lebanese people who are living in the refugee camps because they did a lot of things and they don't want to be arrested by the police and so on. So, and definitely, I guess Zena might help us also to better understand the situation further, and definitely we'll get back to you with more information. So, just for you to know what's definitely, it's your right to say I don't want to take it, but it's very important for you to better understand the vaccine and how it works and so on. So I'd be more than happy to conduct a session with you to explain everything to you, and I'm sure you will be able to take your decision based on evidence.
Thank you so much for this information. But I want to ask, if in case, as you said, that the ikama, we'll say it clearly, the ikama is not important for this vaccination process. But my second question is, will this be available for free or at a lower cost for the migrant workers? Because not all migrant,
Free.
is it free? Because
It's a
we
it's
cannot
free for
afford it.
everyone, and I'll tell you, yeah, and I'll tell you a very important point that honestly I just knew about it yesterday. It's that a lot of migrant workers who are working in hospitals, like cleaning in the cleaning section in corona departments, they are considered as phase one priority for the ministry, and they're getting the vaccine. And we have a lot of numbers, especially from AUB and those hospitals that recruited the migrant workers in their hospitals to deal with corona patients. So they took the vaccine, and it's for sure. Yeah, that's why when we're talking about the priorities, I'm not saying that because I love the government or us. No. It's just about transparency and for you to make sure that they are trying to be very wise in their in the distribution thing and so on. So I knew, and it was proved 100% that migrant workers who are currently also working as a frontliners are taking the vaccine too. So yeah. And definitely it's not at low cost. It's not a private thing. It's the government is distributing it for free till now.
But we are not on the priority list to have this for now, right?
Yeah.
Sorry, can I, Jana, just to not to raise expectations. I mean, this is the vaccines are not at all my field. It's more about protecting the rights of the migrant workers. But on the vaccine issue, again, from this session, we're trying to understand your questions, the level of your knowledge to see if there are any gaps, your fears, your perception. So we follow up on this with communication tools that are easy that you can share with others on via WhatsApp and Facebook. So if there are any fears that you have, for example, although Diana just said now that the Ministry of Public Health is not the same as the Ministry of Interior and General Security, and they will not share the information, but you saying that some of us may be afraid is still a very valid point. So even maybe now you know us, you heard Diana, you say, okay, she's telling the truth, but people who don't know Diana or who don't know you very well or who don't know will not take this as, will not trust what you are saying. Exactly. Plus, we cannot, even us who are facilitating this discussion, we cannot make that promise ourselves. So what you want to do with this information is to make sure that we have a public announcement. This is what you want to try to do, to push for a public commitment from people in the government to say that no one will be arrested if they are registering for the vaccine. We want to have assurance in order to protect you. Okay, so it's not just what we can say. We want something that really gives you assurance for those of you who wish to take the vaccine.
Actually, it's not only for you. Again, it's a lot of people who are stateless and different, and with different issues. It's not only for them.
And I have a question. You might have mentioned that at some point my connection was going. Did you try at all to enter all the details, any of you, in the vaccine that you register? Because again, in terms of priority, you're right, Miriam, Mira, that maybe as your group, same as me, I am 49. I'm not on the priority list, although I wish I can take the vaccine now. But I registered because once my turn is there, I want to take it. So even if you are not a priority because it's not per age group and you're not vulnerable, registering will put you on the list. So did any of you try to register and find difficulties in terms of filling the application? The answer to that will also help NGOs like KAFA and the other organizations that we work with, how we can assist you further for those of you who want to register for the vaccine.
Actually, they mentioned that, Zaina, but it's not friendly at all.
Exactly. Cynthia, I think, mentioned this. Sado is joining us from the Nepalese community. Just wanted to say confirm to everyone, like what you are saying is very important for us, and we want to use this information to try and communicate, or like Zena said, to make like this concern addressed publicly, so we know there is no risk on undocumented workers. And Cindy, you mentioned that you tried to fill it and you found the other section, which is which you thought or you knew it was for the domestic workers. If you could tell us, while filling it, did you Cindy is no longer with us. Okay. Did anyone other than Cindy try to fill it? Did you get help from someone else while filling it? Can someone share?
No, for me, I didn't try to register because I'm afraid of the vaccine.
Okay.
Okay. So this is related to the vaccine. I have also another question related to how to reach out to other community members. So just, ladies, I'm sure that you know about that, but I'm just wondering if you are trying to reach out to those people. So for example, I came from a very rural area in Lebanon, and I'm sure the helpers that are working there, or the domestic workers, they like, I feel like 100% sure that they don't know about these communities. And as you know, some of them, even they don't have their phones all the time with them, and so on. Are you taking those people into consideration while you're trying to spread awareness or helping those people? Are you thinking about any strategy that we can reach out to those people?
Are you asking this from us, community leaders?
Yes.
For us, community leaders, we have, as far as the Beka and the Tripoli area, and as far as the Nabatiye in the south, we have some community leaders also there, and we try to link through them and try to communicate for those who are under their jurisdiction, to try to 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 inform those who doesn't have the phone. At least when they meet in the streets, you try to say hi and talk to your kababayans. We call it kababayans, or fellow countrymen, and try to give information as much as we can.
This is very interesting. Good. And Maya, you're talking about different nationalities, right? You're not only interested in one nationality. You're trying to help everyone.
Yes. I'm not. We are focused on the Filipino community, since we are the biggest community, I think, in Lebanon. But we also cater to other nationalities.
Okay, great. Okay, Rena, I guess from my side it's over. I asked all the questions, but just again, because I noticed that you need information about the vaccine itself, and as UKEMT, we are able to give you the accurate information approved by the WHO. So definitely we're ready to help. Purity, if you want also to say anything, please, the floor is yours.
Thank you, Diana, and thank you everyone who is participating. First, I want to appreciate that the participants who have spoken, they have really said it very well. They know what is COVID, what causes COVID, how do you prevent yourself from COVID. So mine was to add on the prevention, and as they said, first you wear your mask, you keep distance, and washing hands. Because you don't have to say you have to sanitize, because sanitizers are expensive, but the most important is to make sure that you wash your hands with soap and water, and also to avoid touching your eyes, your mouth, and your nostrils before you wash your hands. So always make sure you keep washing your hands, because as one of the participants said, that those virus, you can
get them from the services. That's why we have to keep washing hands every now and then. The other thing I would like to address is that I have heard most of them saying that they really fear taking the vaccine because they don't know if they would get the right vaccine or something different. But I would say that this vaccine which is in the country is from one company, and even the domestic workers, they will not be told this is a place for you, only the domestic workers. They will be told to go and get the vaccination where everybody else is getting the vaccination. So they should not fear that they will get a different vaccination. It's the same one that everyone is getting. The other thing I wanted to mention is about the reaction. I heard most people saying they are scared of how they will react, and it might be they don't know whether it can be worse or what. But I want to say that the reaction of the vaccine so far, as we know, since we started the vaccinations here on Monday, I've not had anyone who has died because of the vaccine, and the reaction is normal. If you get the vaccine, it is made of antigen, something called antigen, which makes your body to produce antibodies, and antibodies is the soldiers that make your body protect yourself from infection. So the reaction, the more you get, because that means that your body is going to produce more antibodies for you to be able to fight the infection that infection of COVID that can affect you anytime. And I also want to say that the fact that some people, I have also heard many people saying that they have been staying with people, working with people, but they are not getting. But you never know when your body will be weak and you get the infection. So as also a part of prevention, is good also to get the vaccination, just to make sure that you are protected in all ways. I think that's all for me for now, Diana.
Thank you so much for the summary, Purity. And again, I don't want to take too much from your time, but I will be coordinating with Ghina. So it seems that you have, let's vote now. So who would like to, for me or from UKEMT, to organize like a session for you? Maybe you can invite other people to attend a vaccine session to get more information, accurate information about the vaccine itself. Let's vote by saying yes, at least.
Yes.
Okay, yeah, perfect.
So I have from.
Are we just two, Miriam and Myra?
Yeah. What about the rest? So I think we can communicate after the meeting, this session. We are very happy to coordinate it and see how what's best. I think we could make use of the platforms. Myra wanted to use YouTube. We can definitely do that to try to reach as many people as possible. And definitely it's also important for us, and I think Zena agrees as well, to make sure that the concerns you mentioned about being safe from detention are heard, and maybe we can also use the organization's coordination effort and communicate these needs. Thank you, Diana, so much for showing interest in reaching to the communities and for preparing the questions for this session, and Purity for all the information you provided. Hopefully, we will be able to elaborate on this information in the future sessions.
Thank you so much, Rena. And I would like just to say bravo to each one of you, because you are really inspiring You are amazing ladies. You're working very hard, and you have a lot of knowledge, by the way. Believe me, because we met a lot of people during our mission here in Lebanon, and we figured out now out of this discussion that you know a lot of information, you have accurate information, and you're trying not only to protect yourself, but by the preventive measures that you are taking, you also protect people around you. So thank you so much for your efforts, and hopefully we will be able to meet soon to discuss more about different topics related to COVID. Thank you, Ghina, and thank you, Zaina, also for joining us today.
Thank you.
Thank you so much.
Thank you, everyone. Hope to see you face to face.
Yes,
very
we still have
soon.
lots of
I
questions.
miss you
So
all.
I hope we still have another session because I still have some questions to ask.
Of course, Mayra. I will communicate with you and your groups after this meeting to try and set this session.
Rena, before we go, if I may, Myra, maybe if you have additional questions, if you
Yes,
can
I have.
send them by voice to Rena, so she can also send them to Diana, so we take them into account in this assessment.
Yes, I have one.
Rena, what do you think?
I have one question. Like it's still in relation with the vaccine, as Purity was trying to explain about the effects of the vaccine, how important the vaccine is for us. But I have one question. What are the cases that will not allow a person to have the vaccine? Like they have underlying diseases, like I have, like me, I have a history of leukemia. Others have history of kidney problems, high blood pressure, heart disease, and other ailments. So this is one big question: are they, uh, um, what is this? Qualified, or are they advised to take the vaccine?
Rina, do you want me to answer now, or you prefer to put all the questions for the vaccine session? It's totally up to you.
I think we can give Mayra an answer, and then maybe we can develop.
Elaborate more.
Yes.
Exactly.
Okay, great. Just Mayra, for you to know, those people with chronic diseases are the people at high risk. Yani phase one. Yani the government and everyone in the world are giving them the priority. We have a few cases where people cannot take the vaccine in nutshell and briefly, and I can elaborate more when we have the vaccination session. People with active diseases, like people who have cancer and they are taking the chemotherapy, or people who have like fever, like at the moment of the vaccine, they can't take the vaccine, and people who have high allergy to the components of the vaccine, and those things can be definitely prescribed by or described also by the physician himself. So the physician, your physician, the physician who's following up on the cases related to active diseases and so on, they will be able to tell you whether you can take the vaccine or not. So this is in a brief description, but people with high blood pressure, chronic disease, I mean high blood pressure, diabetes,
Kidney problems.
I don't know. I forgot now the diseases, but I mean those people who we consider them as at higher risk.
Okay.
Does it make sense, Myra?
I still need some more elaboration later by the next meeting that we will have. But I have to have a very good assurance that it will not have a negative effect on people, because I wouldn't like, like I receive messages like, being a leader, they respect your opinion. So I don't want to give a wrong information. That's why I always just say, it's up to you to decide. This is my opinion. It's not for me to decide for you. You have to make your own decision.
Yeah, don't worry, Myra. Once we have this session, I'll be also like I have our colleagues from the UKMT who are very, very professional. They will be able also to join us and to answer also your questions from the medical point of view. Okay,
Okay.
so don't worry about that.
Yes. Okay.
Okay,
Yeah.
so Teresa, you mentioned not hearing. Are you hearing us now?
Maybe they are hungry already and they are just eating.
Yeah. We will not keep you any longer. Thank you all very much for joining us today, and um, we are very happy to have this discussion. It was very useful for us. We always it's very important for us to always hear from you because you are the people like
In the field.
responsible, or you are the people who know best. This was very nice. Thank you, Diana, Purity, and Zena, and all of you ladies for joining. And we will stay in touch, of course. Any further questions you may have, please text me
Just an
anytime you like.
addendum.
And
Gina, just an
yes,
addendum. You know, like fear is a very big consideration to take, because when people has fear in their hearts and then they will do something which they have fear, you know, like it has a negative effect. It will have a negative
of course.
result.
Of course. This is why we are doing this, to understand what people are afraid of and what more information do you guys need. So of course, I agree 100%. It's very important to consider the fears that you and other domestic workers are having. Um, it, this is all I wanted to say. So I will leave it for anyone else if you would like to say anything.
I think it's better to have another session
Yes.
so that we can invite more people so that they will be aware about the vaccine, because there's a lot of things arising, especially negative issues about the vaccine. So I think it's better to have another session.
Okay. Agreed then. We will coordinate for a second session.
Hello, everyone.
Okay.
I'm so
Hi,
sorry
Sadu.
because my connection was lost. So just now I attend. I'm so sorry because I don't know anything about
Taro.
I am sorry, guys.
No worries. No problem.
Better late than never.
I don't have internet here. Right now is coming internet, so it's okay. What you talking about, and I will ask with Miriam so she can explain. Okay, thank you so much, and I'm so sorry, really.
No worries. Okay. Thank you for joining. So Miriam will brief you. Okay, thank you once again. Have a very nice evening. Bye.
Good night.
Bye-bye.
Good night, everyone. And thank you for the information.
Thank you. Bye, everyone.
Guys, thank you for being with me also, at least because I wanted to share the meeting, but also them, they were not using the camera. So next time I will do it on StreamYard at para makaakyat din kayo at magtanong. Okay, guys, and I will be signing off now before the electricity will cut me off. Bastos yung electricity na yan. So, thank you again for being with me. Joel Sanchez Summer Channel, thank you for being there. And for the rest na naandito, hindi ko kasi ma-mention ang name. I know you're not commenting, but I know you're just listening. Thank you sa pag-BG-BG dyan. Okay? So, napay late murag summer rain lang. Oo nga, si Saro. So, guys, thank you again. Thank you again. I hope I was able to share with you some little information about the regarding sa COVID-19 vaccine, and para doon sa mga undocumented, guys, it will not cost your freedom, okay? But it's up to you to decide whether to take the vaccine or no. And it's for free, as they say. But we don't know how sure, how free is it, okay? Promises are made to be broken. So, till here, bye bye, guys. Good evening.